So, good afternoon, good morning, good evening, wherever you're joining from. Welcome to this webinar. Thank you for joining today's webinar. My name is Dennis Okidi. I'm the Director Supply Chain at the USAID Strengthening Supply Chain Systems activity implemented by MSH Management Sciences for Health in Uganda. I'll be your moderator for today. Today, we're discussing a very important topic on digitalization of Uganda's national health supply chain system. The objectives of today's webinar are threefold. One, to discuss status and challenges in the digitalization of the Uganda's national health supply chain system. Two, to really share experiences and lessons learned in the process of digitalizing Uganda's national health supply chain system. And three, to explore what still remains to be done to ensure that we have a fully digitalized national health supply chain system. On the webinar today, we are joined by 4 eminent speakers and 3 distinguished panelists who have very vast experience in implementation of digital health systems. We'll be joined on the call by Dr. Diana Twine, the Permanent Secretary of the Ministry of Health. Already on the call is Ms. Solomon Sevume, who is actually the Management Information System Specialist at USAID Uganda. We'll be also already joined on the call by Mr. Shimelis Baleina, who is the Supply Chain Specialist with the Global Fund for HIV, AIDS, TB, and malaria, working off the headquarters in Geneva. We've also been joined by Dr. Eric Lugada, the Chief of Party for the USAID Strengthening Supply Chain Systems activity implemented by MSH in Uganda. Also on the call as a panelist is the Assistant Commissioner for Health Services, Health Information Management Division at the Ministry of Health, Mr. Paul Mbaka, the Chief ICT Officer at the National Medical Stores, Mr. Stephen Chisuzi, and Dr. Charles Kabugu, who is a Senior Executive Consultant at the Chirudu National Referral Hospital. So you're welcome, our dear panelists and speakers. Before we start off with our actual webinar, allow me to quickly go through some few housekeeping remarks. One is a remark on participants. You've been muted and you will not be able to unmute yourself. All participants will not be able to view fellow attendees. But importantly, the chat function will be active and you'll be able to interact with panelists and fellow participants through the chat function. So as we continue with the webinar, feel free to actually interact with fellow participants through the chat functionality. Take a moment to actually make sure you familiarize yourself with the Zoom platform, since you will not be able to really unmute and speak. So make sure you familiarize yourself with the chat functionality. Your questions will be collated and we'll be able to respond to all of them by the end of the call. Should you drop off the webinar, very importantly, you will be required to go back to the registration link that would have been sent to your email and be able to log in seamlessly without requiring to register again. So our team will be looking at the chat box, and should your question not be answered, we will be able to prepare an exhaustive response to all the questions at the end of the webinar. So thank you for joining. You're very much welcome to participate, interact, and hear the experience that Uganda has been able to go through in digitalizing the national health supply chain system. So without further ado, we'll go straight to hear from our speakers. I've been informed that the Permanent Secretary will not be able to join, but he has delegated the Assistant Commissioner, Health Services, and Head of the Department of Health Information Management, Mr. Paul Mbaka, to actually make her remarks. So with that, I will hand over to Paul. Paul, you are most welcome, but just to make sure that we know who Paul is. So Paul Mbaka is actually the current Assistant Commissioner for Health Services in charge of the Division of Health Information Management. He's an experienced statistician, M&E specialist, researcher, database and software developer. Before joining the Ministry of Health, Paul worked as the National Professional Officer for the African Health Observatory and Real Strategic Information Systems at the World Health Organization here in Uganda. And previously, Paul worked as the M&E specialist with the World Food Programme, also with the UN in Uganda. Paul currently provides oversight for all Ministry of Health efforts in digitalizing the national health system as guided by the Uganda Health Information and Digital Health Strategic Plan 2021 to 2025. So Paul, you're welcome to give your remarks on behalf of the Permanent Secretary. And again, welcome everyone for joining the webinar. Thank you, and over to you, Paul.
Thank you very much, Dennis. Welcome everyone. Welcome to this. Good afternoon to all of you. I know we are probably in different time zones given the colleagues who have been able to join. Digitization is quite important for the government of Uganda, and looking specifically at digitizing supply chain. There are quite a number of benefits that Uganda could gain if we were able to digitize from end to end in terms of our supply chain management. As you may all be aware, the government of Uganda, through its National Development Plan, calls on all of us to digitize service delivery as a way of ensuring quality, monitoring, and accountability. This call is reflected in the Ministry of Health strategy, and as well as the Health Information and Digital Health strategy that the Ministry of Health is currently implementing. The Ministry of Health is keen on ensuring that there is commodity accountability, that the commodity that comes into Uganda is traceable, and if when resources are provided, we are able to account for it. In terms of optimizing service delivery, it is important for us to note that in this country, it is not uncommon for there to be facilities that are out of stock when we have facilities that are nearby that might be overstocked. Digitization has a role to play here by ensuring that we are able to have visibility across the board on where commodities are available, to enable us redistribute and ensure that those that we provide services to are able to access those services. To ensure that we can have complete reconciliation of commodities that we have in country, what we've been able to deliver to health, to the different points of care, and to ensure that there is reconciliation between prescriptions given, treatments provided, services provided, and commodities that we are able to deliver. Ladies and gentlemen, it is my hope that through these discussions that we are having today, we are able to discuss where we are, the challenges that we face, what we need to do going forward, and that you, participants in this meeting, are able to provide meaningful insights to ensure that we can deliver this, to ensure that we can strengthen our supply chain system, but we can also provide information so that you are aware about the status we are, and you can participate in shaping the supply chain system in Uganda as we move towards digitizing it. Ladies and gentlemen, I would like to officially declare this webinar open. Thank you very much.
Thank you. Thank you, Paul, for the remarks on behalf of the Ministry of Health Permanent Secretary, Dr. Diana Twine. We do recognize that over the course of the last few years, the Ministry of Health has made great progress in digitalizing health service delivery. Very importantly, we know that with the digital health strategy, the Ministry of Health is putting in place implementation of the electronic medical records, and good progress has already been made in high-level facilities, particularly regional referrals, and hospitals, as well as health center fours are now being also implemented. So this implementation, as we do know, is going to be very helpful in ensuring traceability, accountability, and visibility within the health supply chain system where implementation has reached. And we do know that the Permanent Secretary is very passionate about digitalization. And one of her remarks in the previous past was that digitalization is the oxygen that we breathe in the health sector. So thank you very much, Paul, for the remarks on behalf of the Permanent Secretary. Thank you again, participants, for joining. I see we do have a good number of participants. For those who joined in a bit late, you are most welcome. Please do register in the chat box, tell us who you are, and please go ahead and interact with the panelists, ask questions. We will be able to respond to the questions as the discussion progresses. Allow me to then move on quickly to our next speaker. Our next speaker is Ms. Salome Sevume. She is a Health Information Systems Specialist at USAID Uganda. Being an expert in health management information systems, Salome leads USAID Uganda's Health Information Systems portfolio and provides oversight to close to 40 US government implementing partners in planning, designing health information systems, and ensuring quality data collection, analytics, and more importantly, their use in driving evidence-based decision-making throughout the country. Salome, you're welcome to give us your remarks. Thank you very much.
Thank you very much, Dennis. Good afternoon, all. Good morning, depending on where you are in the world. And it is my pleasure to pick up from where my friend, my colleague, Dr. Paul Mbaka has stopped. Really, it is my pleasure to be here on behalf of the US government to talk about digitization of the supply chain process and how it informs decision-making, ensuring that commodities are where they're needed in the right quantity and at the right cost. We know that we need to have life-saving medicines available at facilities whenever a patient needs them. And Uganda's disease burden is dominated by communicable diseases, which account for over 50% of morbidity and mortality. Malaria, HIV/AIDS, TB, diarrheal and epidemic-prone and vaccine-preventable diseases are the leading causes of illness and death. Making supply chain data visible, making sure that patients get the right medications and care they need can only be achieved through a digitized system. Visibility of stock data at all levels, especially at the health facility, allows for quick action to be taken in the event of low stock or stock out, just as Paul mentioned in his remarks. A critical component of USAID's 5-year strategy in Uganda focuses on strengthening the health system to support stronger governance within the health sector and advance human resources for commodity visibility. To successfully implement digitization, it is critical that all stakeholders work together to advance the digitization strategy. And it is a good thing that the Ministry of Health has one in place. And it is a good thing that we all own it and all understand it as we use it. In addition, stakeholders need to invest in human resource changes that are necessary to facilitate digitization. Health commodities are a critical component of the health system and should be available, as I said, in the right quantity and at all times. Additionally, it is important that these commodities are traceable and fully accounted for at all service delivery points. It is important to note that Uganda has an inflow of commodities valued at over $430 million annually, and the government of Uganda contributes about 36% of the commodity budget, while development partners, including Global Fund and the US government and others, contribute the remaining 64%. Digitization will improve commodity accountability and traceability, building off of existing logistics management systems used in other industries and countries. So while development partners, including USAID and Global Fund, as I've mentioned, and others have supported Uganda to digitize the supply chain system, the dream to have a fully electronic system is really far from reality. Nonetheless, we've made some progress towards this. I'll give you just a few examples. At facility level, USAID has provided over 500 computers to support the implementation of the electronic logistics management information system. Furthermore, USAID has worked at the national level to support system integration across the country. USAID has also invested about 10 million in the enterprise resource planning tool for the national medical stores. This tool has improved operational efficiency at the national level. At facility level, since 2020, the tool has enabled over 1,700 facilities to order their health commodities electronically on a bi-monthly basis, moving away from the onerous paper-based ordering system. Even with all this, there remain several challenges to achieve a fully digitized supply chain system. Constant availability of power and internet is key. In addition, investing in people will result in higher success. It goes without saying that digitization will require a multi-sectoral approach, and the role of the local government or the Ministry of Local Government in accountability and governance for the success of this implementation cannot be overemphasized. We therefore call on line ministries, Ministry of Health, the Ministry of Local Government, Energy and Mineral Development, and ICT to work together to advance the health digitization agenda. Finally, I would like to say that USAID is committed to support Uganda to fully implement a digitized system and lead to a resilient and accountable system. Thank you very much, and over back to you, Dennis.
Thank you very much, Solomon, for the remarks. Indeed, USAID has provided very long-standing technical and financial support to Uganda in building a responsive and resilient national health supply chain system. This has spanned over 15 years, and digitalization has been one of the key pillars in this journey. As Paul did note also, the supply chain digitalization gap is still large, and we look forward to even more support and commitment from USAID to the government of Uganda in digitalizing the national health supply chain system. So thank you very much, Solomon, for those remarks. Welcome again, additional participants who have just joined us. Let's keep the conversation going in the chat box. Feel free to ask your questions, put a comment, such that the panelists are able to prepare to respond to them. Without further ado, allow me to introduce to you our next speaker. Our next speaker is Mr. Shimelis Baleine. He's the specialist public health supply chains at the Global Fund to fight AIDS, tuberculosis, and malaria. Shimelis works with country teams, including the Uganda country team, to actually implement supply chain transformative initiatives, particularly in high burden and high impact countries in Africa and Asia. Over the past 2 years, Mr. Shimelis has been the Uganda contact person for supply chain digitalization work funded by the Global Fund through catalytic investments. This has seen over 273 health facilities installed with digital supply chain platforms, and also initiatives around tracking and tracing health commodities using global standards such as GS1 have been initiated. Shimelis previously worked with Crown agents and also with the United Nations Development Program as well as management sciences for health. So Mr. Shimelis, you're very much welcome to give us your remarks. Over to you.
Thank you so much. Good morning, good afternoon, everybody. I think there's sufficient introduction about myself, and I will direct, in the interest of time, I will move to the updates. So just to give you a bit of background, when we start investing in digitalization, we usually at the Global Fund level, we start with diagnostics. We do assessment to understand, so that is demand driven, to understand there is a real gap. So the digitalization and GS1 investment we put in Uganda is dependent on a study which was conducted in 2021. And based on this study, the challenges for digital solutions and technology readiness assessment conducted, we found out that 40% of HMIS 105 reporting, which is actually the LMIS component of the HMIS, only 40% report, and out of that, only 10% are complete. And plus, there is limited, data collection, effects, and planning, and decision making, and visibility, and traceability of commodities. And out only 25% of the 1,700 plus health facilities had computers. 16%, only 284 had functional ELMIs. Stockouts, expiries, and wastage at the facility are rampant. Gaps in governance and accountability, and inadequate human resource capacity. And additionally, there was limited budgets. So only 70% of public sector, over 70% of public sector health commodities are financed by development partners. As you can see from this graph, the adequately stocked health facilities, for example, for HIV, ARV, only 33%. The consequence of having not adequate optimum stocked for ARVs, it is resistance. So as you can see, there is stock out, there is overstock, there is also understock. In facial medicine, similarly, 24% appropriately stocked, 18% for lab, 28% for reproductive health, and 30% for TB. So these are the driving force for investment in digitalizing, because we believe that information system is the heart of the supply chain, the heart of the health system. If we invest on information system, not only providing the ELMIS tool, but also the hardware and software is necessary. Not only that, ensuring that there is internet connection, there is power, and also adequate human resource. Global Fund is a very strong partner for 2021 to 23, GC6. We have almost 500 million procurement of commodities. So as you can see, Uganda is a very highly commoditized grant. That means we need information system. We need strong LMIs. So our decision to procure 680 computers, out of ensuring that 273 health facilities enabled electronic medical records and LMIs and data visibility. And if you break down this, we have covered 25 hospitals, 86 health center 4s, and 162 health center 3s, and overall 273 health facilities. These 680 computers are distributed. And this, we don't only distribute these computers, we make sure that the LMIS is installed and functioning. And additionally, out of these 273, 256 health facilities have local area network. That means that data is entered when the patient comes at the clinic, and that same data about that information about that patient goes to the pharmacy, goes to the store. So there is no redundant data entry, there is synchronized, and also this makes sure that there's data integrity across the board. So the investment is making sure that these are the high burden health facilities we need to prioritize. But As you can see, Uganda has more than 5,000 health facilities, and out of that, perhaps 1,700 are high burden, high volume health facilities. But digitalization shouldn't stop there, and it should continue. The other initiative we work on is the GS1, the Global Standard for Traceability. This is 3 areas of support, or three information. So one area is that the recall management, the traceability will help. The other area is the track and trace and the product verification. Additionally, we help with national health product, development of national health product traceability strategy. We ensure the GS1 enabled health product registry. And also we are committed to, beyond this proof of concept, we are committed to support the rollout of this into nationwide once the proof of concept is finalized. This, we don't stop there actually, because this needs to be part of the national data warehouse. So we will also support the interoperability layer, because we have multiple systems. We cannot integrate all of these systems together, but it's important to have this interoperability layer where the ELMIS, the ERP, the traceability tools are able to push data that is needed to make decision making. So this is going to be quite a journey, but quite interesting journey, and it's not an issue we are going to resolve in a year or two. This could take 5-10 years to roll out GS1 and digitalization throughout the country, but we prioritize dependent on the burden of patient and also the priority, the specialty of that health facility. Just a bit of GS1 to cover. I think the GS1, as you can see, is a simple technology, but now becoming very common because it's useful to ensure quality and safety of medicine. Patients are able to verify their medicine. Clinicians also able to verify their medicine by just scanning. Additionally, we can track and trace a commodity. For example, if we have a DHL parcel, we can track based on the code they gave us. If you lose that commodity, we can also trace where that commodity is appeared. And also it is helpful for record management, especially during adverse drug reaction. The Ministry of Health, the regulatory authority, can make easy decisions to trace that medicine and recall that medicine. So GS1 is a monster really, but we are just starting through a proof of concept of 3 or 4 commodities, and then based on the costed implementation plan, we will roll out to the larger commodities. I think I will stop here, and I hand over to the moderator. Thank you, Dennis.
Thank you very much, Shimelis, for the remarks. Definitely from your remarks, we do see that the Global Fund is a key partner, not only in the digitalization space, but also in funding commodities for HIV, malaria, and TB. Through the support that the Global Fund has been providing to the country, we've seen a significant amount of hardware infrastructure, including computers and networking equipment provided to high-level facilities that are now championing the implementation of paperless health service delivery within these facilities, but also bringing the possibility of tracking commodities down to the patient level. So thank you for the remarks, and thank you for the support that Global Fund is providing to the country. So just a quick reminder to the participants, please feel free to use the chat box. Thank you, Simeon. Thank you, Michael. We do see your comments coming. We'll respond to them at an appropriate time, but please keep the conversation going. Next on, I will introduce our speaker, who is the last speaker in terms of the opening remarks. We do have Dr. Eric Lugada, who is the Chief of Party for the USAID Strengthening Supply Chain Systems activity implemented by MSH in Uganda. Dr. Eric is a medical epidemiologist and a senior public health physician with close to 30 years experience managing public health programs in Uganda and beyond. So Dr. Eric, you're welcome to give remarks on behalf of the Strengthening Supply Chain Systems activity. Over to you.
Thank you so much, Dennis. Hello, everyone. We are excited and thank you so much for attending this webinar. We are a system strengthening activity funded by USAID. We are strengthening supply chain systems in Uganda, and we had a 5-year program with partners, local partners, Advocates Coalition for Development and Uganda Health Federation. The purpose of our agreement with USAID was to support the strengthening of the national health supply chain system by advancing good governance and also increasing local ability to plan, finance, and implement solutions for supply chain, so that ultimately, at the end of the day, their commodities, essential medicines and health commodities are available to all Ugandans wherever they are. Our approach had 3 arms, and one of the arms was to do a targeted improvement in the supply chain functions by supporting the flow of commodities and systems which manage commodities and inventory from the national medical store to the health facility, right up to the patient who takes the medicine and to the community. And the second approach was to provide technical assistance to all government entities, ministries, departments, and agencies to improve supply chain visibility and transparency and accountability, so that we can be able to track, trace, see, and account for the commodities as they flow through the national supply chain. And finally, we're also asked to adopt an approach where we can transition responsibility, ownership, and also financing of supply chain services and activity to the government of Uganda and local partners. And we have been doing that. Luckily, as has been mentioned by the Global Fund, USAID, for one of the programs, I think it's one of its first, graciously accepted us to team with the Global Fund and synergize at the level of development partners to increase the breadth and quantity of health facilities we are going to support jointly. So the program has had some additional resource coming in from the Global Fund to support this effort. So far, we have been able to, when we look at the digitalization itself, we initially, MSH has been in Uganda for the last 15 years, and we developed a national supply chain database. At that time, we called it a pharmaceutical information portal. And this is the background. It was a database holding supply chain data from all health facilities that were recording inventory for supply chain. That database has been transferred to the Ministry of Health and has formed the backbone upon which an integrated health data warehouse has been based as a way to support the ministry to take over digitalization. So that's number one. And in number two, we've been also able to support the National Medical Store, as has been already mentioned, and we'll see later on, to be able to put in place electronic systems for ordering of commodities from the warehouses, from National Medical Store to the health facility. Currently, we have about 1,900 health facilities placing their orders electronically from the National Medical Store. And then because we aim to also improve the digital platform through which all health facility stores can be able to manage their inventory and account for commodity in the health stores, we set out to improve the number of health facilities in this country that can manage electronic data for health, essential medicine, and health commodities in their facilities. And currently, we are standing at about 1,400. We started from 350. 4 years later, we have around 1,400 health facilities, and these facilities are able to communicate their data electronically to the National Health Data Warehouse, and we can be able to track and trace commodities in these health facilities. We have about 6,000 health facilities in the country, and that's just 1,400. So we still have a long journey to go. But more importantly also, we've been able to develop a self-assessment, convert SPARS. SPARS was supported performance assessment for supply chain at health facilities, and it required individuals following. We've converted that into an electronic structure, and currently over 400 health facilities have been able to assess the skills that their supply chain officers have, and also it has a self-learning module where they've been able to educate themselves. And as part of the governance system, we also have developed e-learning modules which are housed at the Ministry of Health online portal, and any health officer can log in and teach themselves about the components and critical elements of supply chain, and not just health officers. The district administrators, the district managers, the hospital managers can also use this portal to learn the basics for governing and managing the supply chain. And currently, over 500 officers and staff in the whole government have been able to take that course, online course. But more critically to that is that we've been able to digitize also the visualization and data analytics of the supply chain. We've handed over this to the Ministry of Health, and we currently have two important dashboards. We have the online health facility dashboard, which looks at all the reporting health facilities in the country, and wherever you are in the world, you can access the current stock status of health commodities, all essential medicine and health facilities currently in the country. And then the second dashboard on the Ministry of Health website is the warehouse website, which looks at the warehouse stock status. With this information, you can be able to tell how much stock do we have in the country at the central warehouse, and how much do we have in the pipeline. And then you can compare that with what we have downstream. So for the first time, we've been able to introduce a digital track and trace component, which can be able to help track commodities and even quantify where they are located. And because of that, we've been able to transition the quantification procurement system in our country for essential medicine and health facilities. It's now semi-automated. Some of the commodities we are using real data, and it's semi-automated. The journey and the plan is to make it fully automated. And then finally, we have also developed a dashboard, which is tracking the money associated with the commodities which are bought and with the commodities which are supplied at the health facilities, so that we increase an element of accountability and be able to track and trace the money and the commodities that are associated with all those commodities which go to the health facility. The permanent secretary last month sent out an assessment of accountability to the districts, and we're asking them to account for the commodities they received, depending on the gap in funding. Now, all this is to improve availability of commodities at the health facility. Currently, we've increased the availability of essential medicine and health facility to levels of 95% at any one time throughout the cycle. And we have, more importantly, improved reporting of online stock status through the DHIS Form 105, Section 6. That's the section which used to report stressor commodities for health facility. This improved from 7%, less than 10% accurate, as was reported by Shimelis, and now it's at 87%. So we believe that as we introduce visibility, we support the digitization process, we will be able to improve not only data use for planning, but for procurement, and also improve efficiency of commodity availability in the country. The journey has just started. We've just scratched the surface. We only have 1,400 health facilities digitized. We have a total of over 6,000 health facilities in the country. And the data we are collecting, although it's available, it's not entirely accurate. And also the need for staff to stick to using data accurately and consistently collecting it, but also using it. So we still need to promote data use, correct and accurate data use at all times. And thank you. And this process, we believe, and we're so grateful to the US government, through USAID and the Global Fund, for supporting this effort on behalf of the Ministry of Health. Back to you, Dennis.
Thank you. Thank you very much, Dr. Eric Rugada, for the remarks. As you're all aware, MSH globally works shoulder to shoulder, meaning they're really embedded in the national systems to really save lives and improve the health of the world's most vulnerable and the poor. But more importantly, through this approach, we are building strong, resilient health systems. In Uganda, we've been privileged to be part of building a strong, resilient and sustainable health supply chain system with funding from USAID through the past 15 years. And thank you, Dr. Eric, for clearly outlining some of the key outcomes that we've been able to support the government of Uganda achieve with support from USAID and, of course, the leadership at the Strengthening Supply Chain Systems activity and the previous projects as well. Now, those are the end of the initial remarks. In the interest of time, we'll move on to the actual panelists of the day. So allow me to quickly then introduce our first panelist, I already did introduce Mr. Paul Mbaka, who is the Assistant Commissioner, Health Services at the Ministry of Health and the Head Division of Health Information. I will not introduce him in detail since I did that when he was speaking on behalf of the Permanent Secretary. So one of the questions that we do hear a lot from our stakeholders is what is the current status of digitalization of Uganda's national health supply chain system? What has been achieved? So Paul Mbaka will be answering that question alongside two other questions. What are the real challenges that the Ministry of Health has faced in providing oversight for the digitalization of not only the national health supply chain system, but health service delivery in general? And then the last question that Paul, in his discussion, will provide insights to is what still remains to be done to fully digitalize the national health supply chain system. So let's welcome Paul to take us through those very important aspects of the digitalization of the national health supply chain system. Paul, you're most welcome to make your submission.
Thank you very much, Dennis. I hope you can hear me well. Ladies and gentlemen, a few years ago, of course, the digitization of the supply chain in Uganda was an obscure, isolated, partner-driven initiative characterized by standalone computers, a dongle per computer, without integrated alternative power, and that posed some challenges. Today, the supply chain system has been digitized, and there have been some strides that have been made. And just to give a quick update on what the status is, I think I can start from the very top. The real silver bullet that has enabled us to have the kind of inertia or momentum that we currently enjoy is the level of leadership, the efforts to digitize health services, and particularly to ensure that health supply chain is a core component of that digitization of the health services, has been spearheaded by leadership, all the way from the president, who has put us under pressure, the permanent secretary, Minister of Health, the minister, the director general. They are very keen on this, and this political will has enabled us to make significant strides. Some of the things that we've done over the years is that we've established core infrastructure to enable digitization, including local area networks and facilities, provision of computing devices like computers that have already been highlighted, tabs, printers, among others. In fact, to be able to steer these initiatives very well, the government of Uganda, working with partners, was able to compile a 10-year roadmap to guide investments across the board in the area of supply chain. And this included a significant component on the digitization of the supply chain in the country. Some of the things that we've been able to do was to digitize at the transactional level, to ensure that health facilities are able to use digital systems to record the transactions that take place, be they receiving of goods, issuing the stock taking that they do, the removal of commodities in form of either expiries or transfers, among others. Issues around reference databases, for example, that could benefit supply chain, like the health facility, the digitized master facility list, or the commodities registry, which colleagues have already highlighted, have been core to this. The e-learning portal, which has enabled colleagues involved in supply chain to keep their skills up to date, to be able to assess themselves, understand their capacity gap, and then this is dovetailed into online trainings that have already been provided, has been critical in ensuring that there's good acceptance of technology. Colleagues, to be able to benefit from digitization, it is important that the matrices or data that is generated from a digitized process can be put to use. Investments have also gone to ensure that there is an analytical platform, which was formerly the PIP, but now has been incorporated within the National Data Warehouse to facilitate access packaging of the data that we generate through this digitization process, to ensure that with this visibility, we can quickly respond to needs, we can plan appropriately, and we can forecast needs. We have also been able to start, not necessarily conclude, work around integration with our national data warehouses to ensure that there is visibility at that level, which we can already do with our online stock status system, but also that when commodities are delivered in facilities, there is a seamless handshake or exchange of data without colleagues at that level being able to re-enter that. These benefits that we've seen so far have not come without challenge. There are things that we've suffered, issues around the level of data or cybersecurity that we've been able to implement. This has been a big challenge for us. Connectivity, to ensure that the internet is available and reliable, and you can be able to transmit your data to wherever they are needed. We have, in many cases, or okay, maybe some cases, failed to stick to plans that we've come up with. For example, there are digitizations that are currently overdue in health center falls, where some of the devices were provided, but the local area network has not been deployed because we were stabilizing at other levels where we were implementing. The data warehouse needs to be finalized. The Ministry of Health is keen to ensure that there is visibility even to the general public. So we're trying to work on a portal that can facilitate open access to some of the data that we produce to really ensure that there is more visibility to the data. Integration of the different data systems, this I've already highlighted, as well as strengthening of the production of hybrid information products. A lot of the information products that we produce currently are very dedicated, and that has limited our ability to triangulate the data with data from multiple sources. What we need to do is to ensure that you can facilitate reconciliation between prescriptions, commodities that are being issued, as well as stocks that are available in facility stores, as well as the higher level stores, including the national level stores. Colleagues, you must take note that the advantage of any technology should usually be to amplify human endeavor. And we have seen significant benefits already with the supply chain digitization that we've done. There's a little more visibility, but there's still a lot that needs to be done. Like has already been highlighted by colleagues, we've just digitized slightly over 1,000 facilities, whether with a dedicated supply chain tool or with a more composite tool that also involves management of the rest of the facilities. This leaves us with a lot of work that still remains to be done in our efforts towards digitization. We would like to stabilize our infrastructure by ensuring that the supply of power to enable these digital tools is reliable. Work around integration to ensure that there is end-to-end digital transfer of data to facilitate decision-making at various levels, to ensure that these tools that we provide to facilitate supply chain do not only act as data entry tools, but act as job aids to those of us who are involved in management of supply chain in Uganda. There are issues around attitudes and capacities of health workers, but as I conclude, it is important for us to highlight that if we do not break the barrier that we currently have in terms of data use, a lot of the efforts that we are putting in might be futile. It is important that we think towards packaging the data that we produce in such a way that it is easy to access and consume by those of us that require decision support that would be provided by the data that we produce. Ladies and gentlemen, innovation is an important thing, and this is really the last point I need to make. However, we continue to struggle to come up with a framework that can facilitate us incorporating innovations that are out there into our digitization process to ensure seamless integration of new ideas. It is important that this is something that we look into and ensure that whatever innovations are out there that can help optimize what we are doing, there is a mechanism to tap into it and incorporate it into our work. Thank you very much. Over to you, Dennis.
Thank you. Thank you very much, Paul, for the very insightful discussion of the national supply chain digitalization gains. You've very elaborately provided what the success has been, what the gaps, and what still needs to be done. Your arguments are convincing, and I think the arguments resonate very well with almost everybody on the call towards having an integrated national digital health supply chain system. So to the participants who have just joined, welcome. Our team are looking into the chat. Please feel free to engage Paul and the other speakers in the chat box. We will come to that session in a bit. So we'll go on quickly to the next speaker, and allow me to say that the next speaker will be talking about digitalization at the national medical stores. But quickly, as background, Uganda has 2 national warehouses. The national medical stores that serves close to 4,000 public or government of Uganda health facilities, and the joint medical stores that serves over 1,500 private not-for-profit health facilities and private facilities. Both have been digitalized and have undergone major digitalization initiatives for their procurement, warehousing, and distribution operations. These warehouses have implemented previously end-to-end electronic resource planning systems. They have been able to undertake implementation, albeit with several challenges. And in today's webinar, we shall be discussing the digitalization initiatives that have happened at the national medical stores. And to help us understand these initiatives, we do have Mr. Stephen Chisuzi, who is our second panelist. He is the Chief ICT Officer at the National Medical Stores. Stephen is an expert in information technology management and currently leads a diverse team of subject matter experts to implement what most of us know as the NMS Plus ERP, which is Enterprise Resource Planning application, which is aimed at making sure that the national medical stores operations are fully digitalized end-to-end. Stephen is also a professional chess player and has held several leadership positions on the African Chess Federation. Stephen previously worked with Caltex Uganda before joining the National Medical Stores as the Principal Management Information Systems Officer. So as Stephen comes on board, Stephen will be discussing and sharing with us around 3 major areas. 1, the current status of digitalization within the National Medical Stores, specifically talking to what has been achieved. You'll also be highlighting to us what are some of the challenges that the implementation at the National Medical Stores has faced in digitalizing the procurement, warehousing, and distribution operations. And he will, at the end of his submission, highlight what still needs to be done to fully digitalize the NMS operations. So allow me to welcome Stephen Chisuzi to make his discussion. Over to you, Stephen.
Thank you, Dennis. I hope I'm audible enough.
Yes,
And
Stephen.
good afternoon, colleagues and participants in this webinar. At National Medical Stores, we've gone quite a long way in trying to digitalize our operations so that we can strengthen the supply chain of the sector, especially with regard to our mandate, because our mandate empowers us to be able to procure and store and distribute essential medicines and related supplies to public health facilities as a first call. And then we also participate, rather allow the others who participate in different programs to benefit from our mandate. Now, in our journey of digitization, we've been able to impact in different ways. To date, we've over 3,400 health facilities ordering directly from us. And I had Solomon saying 1,700. That's just a fraction that is ordering through the portal for the commodities that are supplied by the partners. And then we've been able to onboard the users. The user base now stands at over 11,000 users who prepare, approve, sometimes review orders that are submitted through the system, and also track as the orders are processed at NMS. We are supporting the system with a team of about 15 at NMS, of course, that works collaboratively with partners, with IPs and others to be able to keep the system up and running. To date, since we commissioned the system, we've got over 120,000 orders that have been submitted through the system and processed. So that will take us to our next but detailed slide, through which I'll be able to address the questions that have been passed by the moderator. Our current status is, I will not say the current status before I talk about where we were, because it's important to create the perspective. We had operated with, of course, outdated and fragmented systems that lacked integration. And that's key consideration that you needed to put in place before you think about digitalization as a strategy. We had manual processes. Orders were coming in through paper-based records, through mail, through deliveries, physical deliveries, and the workflows that had been built at NMS and also within government were aligned to that manual process. Then we had, of course, as a result, transparency issues. Partners were always putting us to task. People in the political arena were putting us to task. They do not understand or see what we do. We can't report, and others. And then, of course, as a result, that created stockouts, wastage, and all the other problems associated with that sort of process. So where we are now, we've implemented the ERP to replace the legacy systems as a primary, basis for which we process all the data that comes to NMS from the partners and also from the suppliers. There's also this other side of the supply chain that we do not talk about usually when we are talking about supply chain. There's the downstream and upstream. So even our suppliers are connected to that. And we've been able to streamline our procurement because the suppliers now, before they receive orders, we have processed them through the system. We track all the orders. They come, they make advanced shipping notice. They deliver according to a plan. We know the quantities that are being delivered. We plan the receipt and put away of these items and then manage them quite efficiently. All that is done largely without paper. We've been able to eliminate paper from all our internal warehouse processes completely. The paper stops at the receipt of goods, which necessitates that the suppliers bring paper. But as soon as the consignments are received, all the internal processes are paperless until the dispatch. So then we've been, of course, able to impact our accounting and immediately We're able to share data. Lots of activities are able to be tracked in real time. They're time stamped. The processes are auditable. They can be pinned down to an individual and time which they were executed. That is largely benefiting our internal process. But now to the external, we were able to implement a client self-service portal, which many of you now know as CSSP. CSSP was basically aimed at empowering the health facilities with self-service capabilities. And this impacted directly on the timeliness of ordering and aligned it with our delivery schedule. It helped also to improve how facilities track their budgets in terms of the government funding. Our government funding is quite limited, but it is subject to a lot of scrutiny by so many stakeholders. And therefore, it has to be accounted for to the last shilling. And with this tool, the facilities were empowered to be able to manage the procurement plans at the facility level, to track the budget utilization, and then also for us to account the extent of the extent to which we serve against that budget. Now that portal helped us, of course, to eliminate wastage, where sometimes facilities would order things that are not in the plan, and then resources are used for, the limited resources are used for the few items. Then in terms of partners that help us to support the unmet needs, usually ordering was quite complicated. Each partner program had a way of processing their orders, and we managed to unify all that into one portal. And that helped us to be able to converge all the orders through the same look and feel, and then the orders come in time at the expected dates, and therefore are processed with the same logistics, and it's now much more predictable and much easier to track, trace, and then account for. So I believe the partners have also quite benefited from the use of this portal at the same time as the facilities have. So we have met challenges along the way in implementation, and the challenges largely revolve around some of the things that we've heard from Paul Mbaka and others. These relate to power not being reliable and available in all places as expected. Our system is online, and online means you need power, reliable power at that. We don't also have internet. Of course, we lack skills usually when health workers are moved up and down. We have to get substitutes, and those have to be retrained. There's the issue of budget, especially in terms of keeping all these people trained, the facilities resourced with computers. We've had partners contributing computers. And then there are issues of governance. Health facilities workers, district workers, ministry level people still do not fully comprehend how to govern IT. And we are still in a learning process. So we need to acknowledge that and know that efforts need to be targeted in that direction so that we strengthen our governance. People have to know that when data is centralized, it is owned. The health worker, the health facility must know that my top manager is the owner of the data, and therefore is fully accountable to what happens to that data, to keep it securely, back it up, ensure it's not accessed by the wrong people and it's used for the right purpose, and so on and so forth. And then the other challenges, of course, are related with cybersecurity. Of course, we have challenges of user access, then software that's not up to date. All these impact on the usage of the system. We, of course, know that there's a lot that needs to be done. And among them is, for us, the key is to grow, strengthen, and sustain the systems that we have built. And that's part of our key strategy. So the most important elements in that regard are to continue to align with existing and future policies of government, not to operate systems the way Paul Mbaka started and said we had fragmented systems which were running off computers with a single dongle and all that. So if we aligned with government, we will be able to get the best out of the digitalization efforts. So one of our key strategies is to continue to strengthen the alignment. And these policies are there. They are disseminated by NITAU, Ministry of ICT, Ministry of Health, and local government and others. Then we also want to partner with anyone who is working towards strengthening the governance of IT within the sector. That is deliberate, and we will be present and make our contribution. Then we also want to contribute towards the training, skilling of different stakeholders in the use and maintenance of systems. We want to integrate our systems with all the established and approved systems, such as the EMRs and the DHIS2, the IFMS, and others. Then we want to also take part in the change management to increase awareness, desire, knowledge, and ability, and reinforce those who have been able to adapt to these systems. We intend to continue with the collaborations that we already have, but also to look for new ones, especially from our health development partners. And to this end, I wish to appreciate the USAID and SSCS, the organizer of this webinar, who have been at the forefront of these collaborations, especially with NMS and with the ERP and CSSP. Then the Global Fund is also another key participant in these partnerships. So those are our immediate targets, but we're also working towards getting others on board. Then our other to be done is the change management and the communication. Those are just to strengthen them. And then lastly, of course, is to always innovate around the problems we have and the technology that we have, and to see how the technology that we have in place can support us to get solutions. These innovations that are relevant to the supply chain, not every innovation that is out there, so that we continue to strengthen our digitization journey. So with that, Dennis, I hope I've done justice to the 10 minutes that you gave me. Thank you.
Yeah, thank you. Thank you very much, Stephen. You've been elaborate, you've highlighted your journey, what has been achieved, what still remains to be done. But more importantly, you brought out the aspect of integration with other systems, and I think that's the way to go. So in the interest of time, we have our last panelist before we hear from the participants. The chat has been very active. So I want to say that allow me then to switch over to introduce our third and last panelist. Our last panelist is Dr. Charles Kabugu, as I said before. He's the Senior Executive Consultant, or previously called Executive Director for Chirudu National Referral Hospital. So Charles, you will be talking to us about your facility level experience in digitalization of Chirudu National Referral Hospital, basically highlighting how far we have gone in terms of digitalizing the National Hospital at Chirudu. Are we 100% paperless at this point? What are the challenges that you have been able to face and mitigate along the digitization journey, and quickly highlighting what still remains to be done? So welcome, Dr. Charles, to talk to us. Thank you.
Thank you very much, Chair. Good evening, members. I am representing the hospitals that are basically at the tail end of the supply chain, because we interface with the patients to complete the chain. And I'm glad to share our journey at Chirudu National Referral Hospital, which started in February 2023, where we rolled out our electronic medical records. And particularly the one we rolled out is called E-Afia. E means electronic health, Afia is health. And how did we roll out this? We started with trainings. This is very important because if you're going to bring out a new service area, you need to have all the staff on board and they have to buy in. It's a tough journey, but eventually we're able to achieve that. And we completed almost 90-something% of all the staff being trained on the system. The other thing that we had to handle was the change management. Members, as you know, we've all gone through school and we have been used to the paper system. We make notes and all sorts of things. So changing people to tell them that all notes now are going to be digitally recorded is not a simple journey, but we're able to achieve it. We also undertook during that time of February 2023, we're able to do infrastructure enhancements. What do I mean by this? We had to have the whole hospital eventually networked to be able to have access to all the clinical service areas. That means the wards and outpatient clinics. This requires a bit of financial investment, but we're able to achieve that attitude within our means. We're also able to roll out. We started with rolling out in the outpatient clinics. We have outpatient clinics that provide patients who are not admitted. And this was a low-hanging fruit where we thought we should pilot. Once we had success in that area, we were then more confident to go full blast in the inpatient area. Members, I want to say that much as I'm talking about the e-AFIA, there were previous attempts to go digital. We have had things like the RX solutions that has been here for a number of years, and it had done a good job. It had its own challenges, but we have, since after embracing this, I think we've had a lot of benefits to take on the e-AFIA system. In September 2023, we went out of its use into the medicine stores. Members, as you know, the hospitals, one of our biggest budgets are the medicine. So we definitely need to have better accountability for these commodities. So we rolled out this and replaced the previous RX solution that was there, and we rolled out the e-AFIA. And we've had a number of benefits that I'm going to share shortly. We also still strengthen the issue of change management. This one is an ongoing process. Every day you have to continue engaging the staff, because every time they get a hiccup, or every time they get something that slows them down, they want to revert back to their default mode, which is the paper system. So we have to have that continuous engagement with the staff so that we maintain the momentum. In September 2023, we were able to link the lab. What we have right now is that when a clinician orders for lab results for a particular patient, they are sent digitally to the lab, and the request goes digitally to the lab. And once the lab processes, it's connected to the system, and the clinician is able to see the results from this from the lab without having to move any paper. So we have gone paperless in that system, and we've used that linkage to ease information flow from the lab to the clinician. In December 2023, we made a resolution that by 30th June, we should have gone paperless, June 2024. So in December 2023, we started the inpatient module, and we started rolling it out. And it had a number of challenges, because remember, you're going to be seeing patients that are located in different areas. So while in the outpatient, it is the patients who are moving to you, on the ward, it is the clinician who is moving to the patient. So it was a bit difficult to implement, but we designed carts where we mount laptops, and the clinician is able to push it around and enter information by the bedside of the patient, just as you're taking notes. And we're glad that this system of ours has had a lot of success, and it is picking. Many of the clinicians have bought in, and doesn't have major challenges as we speak as of now. What are the next steps that we're looking at as we roll out the digitalization process at Chirudu Hospital? We are looking at the linkage with other stakeholders. One of them is where we get the commodities. Just to give an example, like the National Medical Stores, that is the biggest supplier of our commodities. We think that with adequate integration, when National Medical Stores dispatches and says these commodities are going to Chirudu, if we're linked, these already should be already reflecting on our side and just awaiting a button to say, yes, these have been delivered. Right now, what is happening is that the two systems are not talking to each other very well. We have to manually enter them once the goods have been delivered, and that takes a bit of time eventually with the reconciliation. We are also in the process of now utilizing the data. The previous speakers already mentioned this. How do the institutions utilize the information that we've collected? Other than using it for research, we want to use it as a cost-benefit analysis. We want to see, we closed out this. Are we able to manage our commodities better? Are we able to reduce on the expiries? At Chirudu, we set ourselves a target that we should be able to have expiry of less than 1% of the total cost of commodities. And we're glad that we have been able to achieve that, and we have sustained it, and we're able to easily monitor it, especially after going digital. So we are definitely, the investment that we've put into this whole system is definitely worth it. We have also had an improvement in the reporting, especially to the, it's now easier to generate reports that we eventually share with the different stakeholders, Ministry of Health and other partners that are assisting us. So we have more accurate reporting. I can give an example, like on a busy day, like on Wednesday when I have a diabetes clinic day, I'm able to know how many patients have utilized what particular commodities. Let's say I want to know how many patients have attended the clinic. How many, I had 300 vials of insulin. Which are the patients that have taken these 300 vials of insulin? So I'm easily able to track up to the last patient, up to the final consumer, and easily account for commodities. So we've been able to pick a few items that we have given special interest to, but we're now having learned, now that we've got our feet more firm on the ground, we're now trying to roll out this on all other commodities so that we're able to track all commodities up to the final user. Because when the patient comes, when they present to the pharmacy, all they present is their card, which has got a number, and the pharmacist is able to pick what has been given from the clinician, and they're able to see it on the system, and what they have dispensed is also to eventually identify. The bit also about this that we're also trying to strengthen is the remote visibility, that I can sit in my office without even visiting the clinic and know who of my doctors is in the clinic, how many patients have been seen in that particular clinic, what commodities are being used in the clinic. And this helps a lot in the ordering process. And this helps a lot in especially reducing expiries, because before you had to go to the stock cards, do a lot of reconciliations. Sometimes there would be orders of commodities which are still already in stock. Now we're able to know what is our consumption, what do we have in stock, how much do we need to order. And this has helped us a lot when we're ordering, especially on the online platform under National Medical Stores. So the big gains, like I've already mentioned briefly, the big gains, we have definitely improved our efficiency in management, ordering, and expiry tracking, and definitely become more accountable to the commodities that are given to us. This has definitely been evident. I sit down with my team on a regular basis, and we see increased utilization of the data that has been generated. We have also had another big gain in the sense of enhanced rational medicines use, using generic prescribing, using audits. At Chirudu, we have a team that does regular audits of our commodities, especially those commodities that are quite expensive. We have commodities like dialysis consumables, which are taking a big chunk of our budget. We try as much as possible to make sure that we do regular audits to ensure that we account for this. That has been made now easier using after digitalizing. We're also better in monitoring trends because then because at a national referral hospital, some items move faster at a particular period and they move slower at certain periods of time. And this helps a lot in the ordering process. We have also had a lot of big gains in human resource capacity. Like I said, I'm able to know who is working, who hasn't worked. If you have worked, how many patients have you seen? And so outputs are easier. I'm able to know who is in the pharmacy and how many clients has he been able to serve. So the digitalization process has definitely had a lot of benefits in the purpose of managing human resource. Linkage with other systems, like I said, we have the linkage with the lab system. We are able to track and know how many tests have been done, how many commodities in the lab were procured. So tracking and accountability has definitely greatly improved. Having said all that, I know there's still a number of challenges that we still face staffing gaps, especially in the IT area. We have only one IT manager who is supposed to go around the entire hospital running around, especially when the system gets stuck. We have noted that increasingly, the more we've used the system and the more data we've collected, the system gets slower and definitely the staff need a lot of support. And when it slows down, then that particular service point cannot proceed. So we definitely would do better if we had more staff in the IT department that would support the staff and avoid rolling back into the analog paper system. Infrastructure gaps. Actually, we were lucky that we were able to put a number of things in place that helped us to roll out the system better. But we realized that every day, you realize that every time you open up another center, you need to open up internet, access of the service to that particular point. So the service points, every service point you open up, you will need infrastructure changes to be able to meet their demand. System enhancements, these are not yet complete. We are still going, the developer, we're still putting under a lot of pressure under the developer to make sure that they meet our needs, because every day more diseases are needed into the system, more drugs are needed into the system. The users are thinking, so you realize that the developer has got to keep track of these changes that are being proposed by the users. Staff attitude, I've already talked about it. It is this one maybe goes to my colleagues who have not rolled out the system or who are still at a lower percentage, that it is something that we have to continuously plan for, because people are more comfortable in their default position of using the papers. So every time you give them a gap, they will roll back and start using the system. So you have to continuously keep addressing the issue of staff attitude. Lastly, under the challenges, we really have auditors that are still demanding for the manual tools. So maybe we need to bring our colleagues to know that we are now going digital, and they need to audit us digitally. Otherwise, it becomes a dual entry. You have to keep the stock cards, then you have also to keep to enter into the system. All in all is not lost. We are very glad that we have reaped a lot of benefits in rolling out the system. We have been able to have savings in terms of minimizing losses that we think that were previously being unaddressed. And then the fact that every patient who comes to the hospital, before you get a prescription, you're supposed to be on the system. We are more accountable now to our stakeholders. At least we're able to know that the majority of our items have gone to a particular patient who is in need, other than before where anyone would just get a piece of paper, prescribe, go to the pharmacy, pick the commodities, and they're not recorded anywhere. That would be a big challenge for us. So we have definitely reaped a lot from this digitalization process and open for more innovation to make it better. Thank you very much, Chair.
Yeah, thank you very much, Dr. Kabugu, for the insightful discussion of your digitalization journey. Your journey and leadership towards transforming Chirudu Hospital into an almost paperless facility inspires many. And we will need to continue to receive many of such stories from the other facilities. And I'm sure your center has been very helpful in sharing learnings to the colleagues that are beginning to implement that journey. I know we are on the hour of our planned time, but I think it's still very important to have quick responses and comments to what has been in the chat. Thank you, Paul Mbaka, for being very responsive on the chat. So I'll really allow our panelists to respond to very topical issues. I'll start in the order in which they spoke. Paul, you did speak on behalf of the PS. I know you've responded to most of the issues, but in just a minute or two, could you pick up on any insights that you want to share as part of your closing, but also more importantly, guide on the pace of implementation? I think there's a question in the chat that kept coming around facilities that already have hardware supplied. How quickly can they come on board? So please, in a minute or two, come through with your comment to any pressing issues that you picked up in the chat, and also to the one I've highlighted. Over to you, Paul.
Thank you very much. I think I'll start with the one you've highlighted. And I think it is extremely unfortunate that we have been able to stick to our plans and ensure that all the devices that are required are provided to facilities. This particularly has affected the digitalization at the level of health center FOS, where we were able to secure computing devices in terms of desktops and laptops, but we've struggled to establish the local area network to facilitate their use. But in just the recent past, we've gotten support from USAID to help to help work on some of the local area networks for all their regions to ensure that these devices are used. And that is already ongoing. Some facilities have already started benefiting from that. And hopefully, all colleagues who still have this hardware will very soon receive their local area networks. And whenever we do this, we quickly do the EMR trainings and installation, and colleagues start using that immediately. But I think one of the things that we need to reflect upon that colleagues have also highlighted are the issues around data privacy and protection. This is very important for us, and we are not only looking at personal identifiable information, but data that is not personal identifiable can also be sensitive. We have mechanisms that we put in place in responding to the Data Privacy Protection Act that government of Uganda enacted in 2019 and the associated regulations. But the Ministry of Health has gone ahead to come up with guidelines that we are supposed to follow to operationalize the law within the sector. So that has gone a long way in answering that. Some of the other transactions we have software, and this has already been highlighted, the RX solution, the EMR that we've deployed, helping with transactional management. Some of the other issues I have tried to respond in the chat, and I can continue providing as others provide their remarks. Thank you.
Thank you very much, Paul. So we'll move on if there are any closing remarks from Solomon. And then if there are one or two things you want to emphasize. I didn't see any specific question or comment in the chat, but please go ahead.
Thank you very much, Dennis. I just want to reiterate that USAID is committed to supporting the Ministry of Health on this journey to digitization. We are aware of the challenges that exist, and we will continue to also engage with other line ministries to see this dream to reality. Thank you.
Thank you, Solomon, for the emphasis and the commitment. We'll move on next to Shimelis. Shimelis also, there was just one question that was potentially also misguided to you, but please go ahead and attempt to respond if you wish. It's a question around why do we have overstocks at the same time when we do have stockouts? Is it a quantification issue? How does this happen? And I think it comes in relation to the initial survey that informed the digitalization support that Global Fund gave to the country. So Shimelis, over to you to provide any last remarks, and if you wish, attempt this question. Otherwise, Dr. Eric would actually also talk to this. Thank you.
Thank you, Dennis. Yeah, I think once again, thank you for the opportunity, and we are committed to ensure sustain the gains made in digitalization, and also happy we have Uganda with very enabled environment with digital health strategy that has enabled the investment. And also regarding the, we talk about group of commodities. So for example, in ARVs, we might have 8 commodities. Some are overstocked, some are understocked, some are stocked out. So we are not speaking about one stock, one product specifically. That's why we see for the same commodity group, sometimes overstocked and understocked. So that is the thing. But once again, the investment, the accuracy in data, easier quantification with the digitalization definitely resolve these issues going forward. Another area I have also seen is the use of AI. I think that is important. In some countries now we are using conversational and text chatbots that are going to replace standard operating procedures and job aids. That means, for example, if an individual wants to prepare LMIS reports, they don't need to go to the AI or the job aid or the SOP that how am I going to aggregate? You can easily ask the chatbot that is integrated to the LMIS or the ERP, can you prepare an LMIS report for me? It's really possible. In some countries, they have already tested, it's working. So there is a big opportunity of bringing artificial intelligence into digitalization. But once again, this is determined by digital health strategy, the appetite of the country, and also the capacity, the maturity of the health system. Thank you so much once again, and let's together change the digital space of Uganda's health system. Over.
Thank you very much, Shimelis, for the response to the question and the additional remarks. So we'll move on next to Dr. Eric Lugada to really talk to the question that is saying, how is USAID SSCS activity supporting the challenge of high cost of internet and slow internet for use of data from the pharmaceutical information portal and synchronizing data from facilities to the center. There's also an additional question, and this one, Dr. Eric Shamim could come in on the wish. Shamim could come in. And the question is around how could you explain a bit more the semi-automation of the quantification process that you mentioned? You need to elaborate on that. So over to you, Dr. Eric, to talk about that. And also your last closing remarks. Thank you.
Okay. Thank you so much, Dennis. I'll let Shamim address the semi-automation. Shamim, please do before I speak to internet and close. Shamim, okay. Shamim is a colleague working at strengthening supply chain activity. Shamim, please.
Thank you, Dr. Eric, for the opportunity. Just to pick to the question that Annie mentioned, but again, we can have further technical discussion. How has the ministry been able to semi-automate quantification? So with funding from USAID, one of the USAID projects, Chemonics, has been able to develop what we call the quantification analytics tool. This has 2 modules, one for supply planning, which had been around for some time. But most recently, we had an upgrade that included the forecasting module. And in simplicity, what this does that it already has inbuilt capabilities to establish the health commodity requirements after putting in the key assumptions for a given program. We're able to start with 5 programs. We're able to start with 5 programs to input the assumptions. And once you input this, you actually have a need, as well as the funding gap, as well as, because it's connected to the supply planning module, you're also able to plan your shipments. So why semi-automated is that the team now still has to upload the required data into the system, but once the upload is done, the system auto calculates the commodity need. Thank you, and back to you, Dr. Eric.
Thank you, Shamim. Speaking towards the cost of internet, that's what that stands as one of the biggest challenges, but we have addressed it in 2 ways. Again, with the support from the USAID in the country is supporting various partners, implementing partners, right up to service delivery at the district level. And some of these service partners have resources to continue providing internet to health facilities so that they can do all the reporting, not just supply chain, but also clinical reporting, collecting data on ARV use and other elements. So we've shared the support between us and all other implementing countries. That is number 1. But more importantly, to support sustainability and local ownership through the 10-year roadmap, which we supported the Ministry of Health and us supported the government to put in place. We brought together an interministerial task force to support supply chain services and health in the country. And the Ministry of Information, Communication and Technology committed to support the movement of fiber optics, fiber supply chain, dropping the fiber, internet fiber in the entire country. And they promised by the end of 10 years, they would have supplied fiber and brought it near to hospitals in about 800 hospitals. I think to date, they have brought the fiber near health facilities to about 300 health facilities. The only challenge we have now is for partners to come in, development partners, and support the health facilities to pick the fiber where it's dropped, normally at the main roads, and do the local area network and enable that internet to get into the hospital. So that is ongoing, and that's how we hope in the next 10 years that will be solved, and most of the health facilities in the country will be using internet fiber to support their internet backlog. But as I conclude, we've found that there's been a lot of synergy in terms of working collectively with development partners, synergizing. As I mentioned earlier on, we had the Global Fund joining USAID to support us in acquiring computers and instituting digital systems. But in addition, we had an MO signed with UNFPA. They supported over 90 health facilities in the West Nile. They provided computers in those health facilities and were able computers and support to link health facilities in the refugee area in northern Uganda for the process. And more recently, we've had AMREF providing at least 50 computers in eastern Uganda, which have been installed again in health facilities which we hadn't arrived at. And together, collectively, we have increased the number of health facilities synergistically, which can have a digital print for managing health commodities in the country. So there's a power in all development partners and implementing partners working synergistically to support the Ministry of Health to improve services in our country. Thank you.
Thank you. Thank you, Dr. Eric. We will then move on to Mr. Stephen Chisuzi. Your quick closing remarks, as well as a response to, I think there's a question from Samuel Lukuya saying the ordering process has been digitalized, it's functioning well. The challenge is in the delivery loop. How do you plan to digitize the last mile delivery? Over to you, Stephen, to respond to that and make any quick remarks in a minute.
Thank you, Baker. Yeah, we, of course, as we're planning to roll out CSSP, one of the key things was the issue of proof of delivery, because it's part of the accountability challenges that we faced in the sector, but also as NMS. Now the design allowed that we are able to process proof of delivery on CSSP. But to make it more effective, we needed some additional devices with the aim of completely eliminating the distribution paper, such as the delivery notes and what that are used currently. Now that required us to get some devices, which I think we've been able to get commitment from a partner to fund them. I'll not mention the partner now. And then the onboarding process, because this is a big rollout that would be required to change the mindset of everyone who is used to signing. So that's the delay. But otherwise, the process is already built for last mile. So as of course we make progress in that direction, we'll be able to communicate this rollout over time. But overall, my concluding remarks is, of course, to thank everybody that has organized this webinar, specifically singling out SSCS, Stock MSH. You have played a big role in the digitization journey of our sector, and especially in the supply chain. We appreciate what you have been able to help us to achieve, the 10-year roadmap, the various stakeholder engagements, the alignment of all our digital strategies and all that helps to increase the possibility of success in relation to digitization. So we really appreciate that. And then for the stakeholders who, of course, are increasingly getting fully involved and engaged in these digital initiatives. I do not want to part without saying that as we talk within the sector, and I saw it being mentioned here by Paul Mbaka, that we always have to know that as a sector, we have to first reference what is government planning. And then we know that whatever we do is in alignment with government policy and the legal framework that is in place. That way we can be able to tap into what is already planned and avoid, looking for resources when indeed there could be a provision within our national budgets. So, for example, the parting points of Dr. Eric alluded to the fiber reaching just 300 health facilities to date. You can imagine if this was not known, we could be looking for, efforts to try and connect these 300. But we also know that currently government has already secured a lot of money to onboard other facilities through extending all this fiber. So when we discuss then, if we align ourselves to that project, that program, then we will find that our digitization journey will be much more smoother. So to that end, I need to urge everybody involved, especially now where there are resources required, that we make sure that we are fully aligned. I know the Ministry of ICT passed a policy that requires all the MDAs at different levels to provide for IT people at different levels depending on the size of the entity. Have we used that in our planning so that we plan when government frees up the recruitment to onboard these IT people so that we can help facilities like Childu to move from one person managing a system to having the requisite people to be able to support this digitization in terms of support, in terms of maintenance, but also in terms of innovation, development, and others. So that would be my parting remark. I thank you, and I also thank all the participants.
Thank you, Stephen, for the parting remarks. So I'll move on to our last parting remark, Dr. Kabugu Charles. I think I'll single out one question in particular, which I think is important. How do you enforce use of the EMR system at your facility? Do you sanction staff not inputting in data? What incentives do you encourage for adoption? I think this is an important question because throughout implementation of digital systems, one thing that comes out very clearly is the change management processes are too slow and hampering system adoption. So that's a question that you'll answer as you make your additional parting shot. Over to you, Dr. Kabugu. Thank you.
Thank you very much, Chair. My parting shot is just to thank the partners. MSH has been with us for some time because they supported our X solutions, and they've been with us in helping us with the trainings. So we're very grateful for that and all the other partners. And we are open to really getting better. Regarding the issue of making sure that people enter, we have turned that into a performance measure for every staff member. We print out on a regular basis, on a monthly basis, and share the information publicly with the staff members, and share you didn't meet the required number of days of coverage based on the system. You didn't serve the required number of patients that were agreed and things like that. So we have turned it into a performance measure, and this has definitely improved a lot of utilization. Regarding making sure that they roll it out, we have been in talks with the developer to make sure that some key areas you can't proceed until some fields are filled. Just to give an example, like you can't start prescribing medicines until you've put a diagnosis. So that has helped definitely with its utilization and definitely has improved with the data entry. So I think that is all, Chair, that I have to share. Thank you very much.
Thank you, Dr. Charles. So I think we've come to the end of our webinar. Allow me to apologize for not being very frugal with time. We've gone 20 minutes over our end time, but thank you very much, everyone, for participating till the very end of the webinar. Special thank you to all our distinguished speakers and panelists. The webinar has been recorded, and we shall be able to share the proceedings of the webinar within the next week. And also we shall be able to share a response to all the questions so that everybody who has asked questions gets an appropriate response. We do have a planned webinar in September, delving into supply chain data use. Look out for the invitation for this next webinar in the coming week. Thank you very much. And again, allow me to say thank you for joining us today. And we will see you next time towards mid to end of September in the next webinar on supply chain data use, where facilities and teams from the subnational level will be sharing more of their experience in how digital information on supply chain has helped them to improve their efficiency and effectiveness of management of commodities. Thank you very much. And we appreciate your time and staying up to the end of the webinar. Thank you. We'll come to the end of the webinar. Bye-bye.